Have you ever woken up at 3 a.m., wide awake, staring at the ceiling, and wondered why you just can't fall back asleep? It's not just you. Many older adults experience this exact scenario. You might lie there in frustration, wondering if it's a sign of aging or something more serious. The truth is, waking up at 3 a.m. is not uncommon for older adults, but it can mean a lot of different things for your health and sleep patterns. So why does it keep happening, and how can you improve your sleep to feel more rested, rejuvenated, and ready for the day? As we dive right into the reasons why waking up at 3 a.m. is a common occurrence for older adults, please take a moment to click that like button and subscribe if you're new to our channel, and stay to the end to learn more about the potential health implications and practical tips for improving your sleep. Understanding the deeper factors at play will help you make informed choices and regain control of your sleep schedule. As we age, our bodies undergo several changes, and one of the most noticeable effects is on our sleep patterns. This transformation begins as early as in our 40s and continues throughout life. The body's internal processes, including how we cycle through different stages of sleep, become less efficient as we grow older. Sleep architecture shifts with age. When you're young, your body moves through different stages of sleep: light sleep, deep sleep, and rapid eye movement, REM sleep. These stages are necessary for feeling rested and rejuvenated, with deep sleep being particularly crucial for physical recovery, and REM sleep essential for memory consolidation and emotional regulation. However, as you age, these stages of sleep change. Older adults tend to spend less time in deep sleep and REM sleep, and more time in light sleep. This makes it easier to be disturbed during the night. Essentially, the more fragmented and lighter sleep that older adults experience increases the likelihood of waking up at odd hours, including that frustrating 3 a.m. wake-up. Another reason could be circadian rhythm alterations. Your circadian rhythm, the internal clock that governs your sleep-wake cycles, naturally shifts as you age. For many older adults, the body's biological clock tends to become more attuned to waking up earlier in the morning, making it difficult to fall back asleep if you wake up in the middle of the night. As a result, your body may naturally push you to wake up at 3 a.m., even though you went to bed earlier. The changes in your circadian rhythm can be partially explained by a decrease in melatonin production, the hormone that helps regulate sleep. As melatonin levels drop with age, your body becomes less efficient at maintaining sleep, making those middle-of-the-night wake-ups more frequent. Understanding the reasons behind waking up at 3 a.m. can help you pinpoint potential causes, many of which can be addressed through lifestyle changes or by seeking medical advice. Below, we explore some of the most common factors behind this all-too-common phenomenon. Hormonal changes and sleep disruption can also be the culprits as to why you stay awake in the early hours. For many older adults, especially women undergoing menopause, hormonal changes can have a significant impact on sleep. During menopause, levels of estrogen and progesterone fluctuate, leading to hot flashes, night sweats, and mood swings, all of which can interfere with the ability to stay asleep. These hormonal shifts make it particularly likely for older adults to wake up in the middle of the night, especially during the early morning hours. In men, testosterone levels also decline with age, which can contribute to various sleep disturbances, including sleep apnea. Sleep apnea, where breathing repeatedly stops and starts during sleep, can cause interruptions that lead to waking up during the night, often at 3 a.m. Additionally, health conditions and sleep disorders is another reason why our sleep patterns change. Various health conditions, which become more prevalent as we age, can significantly impact sleep patterns. Some of the most common health issues affecting sleep include sleep apnea. This disorder, which causes breathing to stop momentarily during sleep, is common in older adults and can contribute to waking up frequently throughout the night. Those who have sleep apnea often wake up gasping for air, which can disrupt sleep multiple times during the night. Restless leg syndrome. This condition causes an uncomfortable urge to move the legs, especially at night, which can make it difficult for individuals to stay asleep. Chronic pain. Conditions like arthritis, fibromyalgia, or back pain can make it harder to find a comfortable sleeping position and cause waking up due to pain or discomfort during the night. Urinary problems. Frequent trips to the bathroom, especially for those with conditions like enlarged prostate in men or overactive bladder, can result in waking up during the night. This disruption is particularly common in the early morning hours. Depression and anxiety. Mental health conditions like depression and anxiety are known to interfere with sleep. These conditions often lead to early morning wakefulness, with individuals ruminating over worries and unable to fall back asleep. Medication side effects. Many older adults take medications for various chronic conditions, and some medications can interfere with sleep. For example, medications like diuretics, which are used to treat high blood pressure, can cause more frequent urination, making it more likely for individuals to wake up in the night. Other medications, such as those for depression, asthma, and heart conditions, can also disrupt sleep. If you find that your medications are affecting your sleep, it's important to speak with your doctor. They may be able to adjust your prescriptions or recommend alternative treatments to minimize sleep disruptions. Stress and anxiety are major contributors to sleep disturbances. For older adults, stress may stem from various sources: concerns about health, family, finances, or simply the challenges of aging. When you're stressed or anxious, your body's production of the stress hormone cortisol increases, which can interfere with the body's ability to relax and fall into a deep, restful sleep. If you wake up at 3 a.m. and can't quiet your mind, the anxiety you're feeling may be keeping you from falling back to sleep. This is common, especially if you have concerns weighing heavily on your mind. Another reason is your lifestyle and daily habits. This can also affect how well you sleep. For example, consuming caffeine or alcohol late in the day can interfere with your ability to stay asleep. Caffeine is a stimulant that can make it harder to fall asleep, and while alcohol may initially make you feel drowsy, it can cause fragmented sleep later in the night. Additionally, a sedentary lifestyle can negatively impact your sleep. Regular physical activity promotes better sleep, as exercise helps regulate your circadian rhythm and improves the quality of sleep. Here is another sleep disruptor: napping during the day. Many older adults find themselves napping during the day, either due to feeling tired or to rest after a busy morning. While napping isn't inherently bad, napping too late in the day can throw off your sleep cycle and make it more difficult to stay asleep during the night. If you're regularly waking up at 3 a.m., it might be worth reconsidering the timing and duration of your naps. Sleep disorders. Older adults are more likely to experience sleep disorders, such as insomnia. Difficulty falling or staying asleep is common with aging, leading to waking up in the middle of the night, often around 3 a.m. Nocturia. This condition involves waking up frequently to urinate at night and can disrupt sleep. Changes in the environment. Sometimes, changes in an older adult's environment or sleep habits can cause disruptions in sleep. For example, noise. Increased sensitivity to noise in the bedroom, from traffic, household sounds, or snoring, can disturb sleep. Temperature changes. Older adults are more sensitive to temperature fluctuations, and an overly hot or cold room may lead to waking up. Light. The body's ability to handle light changes as we age, so waking up due to early morning light or street lights may be more common. Decreased melatonin production. Melatonin, the hormone responsible for regulating sleep-wake cycles, naturally decreases with age. Lower melatonin levels can cause difficulties in staying asleep and contribute to waking up at odd hours, like 3 a.m. Reduced melatonin production may make it harder for older adults to fall back asleep after waking up in the middle of the night. Memory and cognitive changes. Older adults may experience cognitive changes, including mild cognitive impairment or dementia, which can contribute to sleep disturbances. Changes in the brain can make it difficult to regulate sleep and may lead to waking up in the early morning hours or experiencing fragmented sleep. Poor sleep hygiene. Sometimes, poor sleep hygiene habits can contribute to early wake-ups. These include irregular sleep schedules, excessive screen time before bed, or a lack of a relaxing bedtime routine. These habits can make it difficult for the body to naturally wind down, resulting in waking up during the night. What waking up at 3 a.m. really means for your health. Waking up at 3 a.m. isn't just an inconvenience, it could also be a sign that your body is trying to tell you something. Understanding the health implications of disrupted sleep is important for maintaining both physical and mental well-being. Number 1. Increased risk of chronic conditions. Sleep is essential for overall health. When sleep is fragmented or insufficient, it can increase the risk of developing chronic health conditions such as heart disease, diabetes, high blood pressure, and obesity. Poor sleep also weakens the immune system, making it harder for the body to fight off infections and illnesses. Number 2. Cognitive decline and memory problems. Sleep plays a critical role in cognitive function and memory consolidation. Chronic sleep disturbances can contribute to cognitive decline, including memory loss and difficulty concentrating. This is particularly important for older adults, as maintaining cognitive health is a top priority as we age. Number 3. Mental health concerns. As mentioned earlier, disrupted sleep is closely linked to mental health conditions like depression and anxiety. Poor sleep exacerbates feelings of stress and can lead to a vicious cycle of sleep deprivation and worsened mood. Managing your sleep is an essential part of supporting mental health. How do you improve your sleep and break the 3 a.m. cycle? Well, if you're tired of waking up at 3 a.m., there are steps you can take to improve your sleep quality and restore your nighttime routine. Here are some practical tips to help you sleep better. Number 1. Stick to a consistent sleep schedule. Going to bed and waking up at the same time every day, even on weekends, can help regulate your circadian rhythm and improve the consistency of your sleep. This will make it easier to stay asleep through the night. Number 2. Limit stimulants and alcohol. Avoid caffeine and alcohol in the hours leading up to bedtime. Caffeine, especially in the afternoon and evening, can interfere with your ability to fall asleep, while alcohol may disrupt your sleep cycle. Number 3. Create a sleep-friendly environment. Make your bedroom conducive to sleep by keeping it cool, dark, and quiet. Use blackout curtains, earplugs, or white noise machines to block out disturbances. Also, ensure that your mattress and pillows are comfortable and supportive. Number 4. Practice relaxation techniques. Stress and anxiety can interfere with your ability to sleep. Consider incorporating relaxation techniques like deep breathing, progressive muscle relaxation, or meditation before bed. These practices can help calm your mind and prepare your body for rest. Number 5. Address health conditions. If you have a health condition that may be interfering with your sleep, such as sleep apnea, restless leg syndrome, or chronic pain, it's essential to work with your doctor to find effective treatment options. Number 6. Avoid napping late in the day. Try to limit naps to earlier in the day, ideally before 3 p.m., to avoid disrupting your nighttime sleep schedule. If you need a nap, keep it brief, 20 to 30 minutes, so you don't affect your ability to sleep later. Waking up at 3 a.m. is a common issue that many older adults face, and while it can be frustrating, it's not necessarily something you need to accept as part of aging. By understanding the factors that contribute to disrupted sleep, including hormonal changes, health conditions, medications, and stress, you can take proactive steps to improve your sleep and overall health. Prioritizing good sleep hygiene, seeking treatment for underlying health issues, and making simple lifestyle changes can help you sleep more soundly and wake up feeling rested and refreshed. If you're struggling with frequent wake-ups at 3 a.m., take action today to regain control of your sleep and improve your overall well-being. Thank you so much for listening. Please remember to like, comment, and subscribe if you are new to make sure you don't miss out on any future videos. Have a great day.